My name is Michelle Swain. I am one of the co-directors with UCSF Citywide Case Management. And my role here is, in terms of our internship, is just that. I'm the co-director and help with my colleague coordinate and put together a whole internship program for Citywide Case Management.
Hi, my name is Phillip Cha. I'm also one of the co-directors along with Michelle of the internship program. I'm also the clinical supervisor of the Senderos team.
So we are an intensive case manager program, and we are an outpatient contracted agency through UCSF. And the population we serve adults over the age of 18 who have a chronic mental illness, mental health. So a lot of the clients are referred to us, and they receive services, and the services involve anything from case management, entitlement, housing, medication services, money management. We also run groups here for clients who like to participate in a number of groups that we have here. One of the other things I can say in terms of the population we serve, the background of all of our clients come from different cultural ethnicities, race, ages. The other thing is that we have teams that represent the populations that we serve, and our focuses are just pretty much to provide all intensive case management to a particular client that has like a high risk of being deviated from other programs. So a lot of clients are referred to Citywide Case Management just for that purpose only, because we're known throughout San Francisco to manage and to provide services to a particular client that have mental health issues.
Yeah, one thing I want to add to that is that Citywide Case Management is probably one of the oldest intensive case management program in the Bay Area for sure. We have been around since the early 1980s. We've had an internship since that time as well. And we also wrote the book on clinical case management called Clinical Case Management, published by Sage Publications in 1992. We have one person who wrote that book, wrote a chapter in there that's still with us, working with us today. So we plan to use the hybrid model of doing 50% face-to-face work with our clients, as well as 50% telehealth, roughly 50-50. So in addition to individual client work, of course, they'll be doing individual and group therapy as well. They'll be required to do assessment. They'll learn about and do some differential diagnosis. They'll be involved in treatment planning. And they'll also be, keeping progress notes and inputting the documentation on our documentation system, Avatar. They may also participate in case conferences within our clinic as well as outside with outside providers. They'll also be participating in weekly interdisciplinary team meetings and, providing some consultations and getting input from psychiatrists, nurses, our vocational counselors, as well as peer counselors. Anything you want to add?
Yeah, so let me add to that. I think one of the things that make our program successful, that I feel like, just based on my experience, because I believe I was an intern as well, is just that how we start out with the interns that do come from the universities and new to this field, because different interns come to Citywide with a different skill set. You have some students who have had some exposure working with this population, and you've had some students who have not had any exposure. So the best way to, like, I would say, ease them into the process of case management is to start them off with maybe like between 3 and 4 clients. Okay. Once they are comfortable in building a rapport with their clients on their caseload, because they'll get clients with different backgrounds, different diagnoses. Then that sets the foundation for them to work closely with those clients. And as they continue to be here over time, on their treatment team, their case manager or their program supervisor will say, hey, are you willing to work with more clients? And that process has seemed to have been helpful, rather than just throwing our students here into having a caseload of 10 to 12, 15, 20 clients, because they're not going to be successful if you do it that way. So that, I think, is the key to making sure that the clients, A, are eased into their roles as intern case managers, B, build rapport with the clients, because that's very, very important, and then C, make them feel confident in the role, what they're doing, and be successful at it. And if they're not, they're able to regress back and come to us and say, hey, I need some support around this. And then their case team or their supervisor will assist them with that.
A lot of our, given the nature of our clients, many of our clients are severely mentally ill, severe and chronic mental illness, right? And so they are often referred from the ER or, sometimes in the jail system. Unfortunately, a lot of our clients their first encounters are with law enforcement, unfortunately. We call this a criminalization of the mentally ill, which is very unfortunate. So we get referrals from jails, ERs, and other residential programs. So it's not a typical walk-in type of client because of the acute nature of our clients' illnesses. And so we get referred by other providers in acute settings.
Yeah. So I would just want to add to that. So one of the key things too is exactly what Phillip said. So as much as we would like to help just about every client in San Francisco that has a background in mental illness, a lot of clients have to be referred to us as through CBHS, which is Community Behavioral Health Services. So they take a collection of all of these clients who are seeking services, and they send what I would call like an intake package to our intake coordinator. That person will review the package, and then that person will link that client up with a particular team or wherever there's an opening. We have this one in, one out process where if we disenroll a client, we have to almost immediately, based on if that client is a fit to our program, to to enroll a new program. So we have to hit our numbers each time. I mean, because some we can't have it where we can have like 10 clients out and we don't have 10 clients in. We always have to hit those numbers. So that's very important here. And I think I call that the CBHS are like the gatekeepers of the people who are referred to us, because we do get clients that come up to Citywide that are not enrolled in our programs. They're seeking services, and that is one of the key things that we tell them. They have to go down to 1380 Howard. They have to seek services there and start the process to be referred to us or other agencies like ours in San Francisco.
Typically, I would say about the average number of caseload per intern would be about 5 to 7 clients. And it really depends on the intern and their capacity, and also the nature of the illness of the clients, the level of acuity of the clients. Because if our clients are chronic and really acute, then obviously they'll need more time. So you can't have too many clients who are that way. So as Michelle had mentioned earlier, we often start off with fairly stable clients. We don't want to overwhelm our interns. So you might start off with 2 or 3, well-established clients who are just doing maintenance work. And then the interns will have an opportunity to, freshly open up some new cases, new referrals from the jail or other acute settings. So we try to balance it out so that we don't overwhelm, the interns. And so it really is a case by case. Really depends on the experience of the interns and the nature of the illness of the particular clients. But it's about, I would say, about 5 to 7. Anything you want to add?
Yeah. So in addition to that, I also want to say, so if our program starts in September, because that's when we actually have we try to follow the calendar year, which starts in September. Students that come in September, by the time December of that year hits, the expectation is that the student is comfortable working with just that small caseload. By the time January comes of the following year, we hope that their caseload will continue to expand the remaining part of their internship. So from January to, let's say, May or June, depending on their internship, when it ends, the goal is to get the intern to be independently as possible with the support of their treatment team, but make them be comfortable as a clinical case manager in an outpatient setting such as ours. So once they go through their internship, they graduate and they go to another internship site similar to ours, they should be completely comfortable working in an environment or a context space like what Citywide is. Or even if they went inpatient, they can see how the clients that are in acute in the hospital, which they're probably at their complete worst, how they have to stabilize in the hospital, then transition back into the community to a program such as ours and what to expect. So they have that experience as well. But the whole goal is to make sure to start them off small, to increase their caseload, and by the time they graduate, that they are fully aware of what is expected at an agency such as ours. Supervision is structured per the school's requirements. So we have a few different spaces for supervision. Of course, you have to have the one-on-one supervision with your clinical licensed social worker. You have to have that because that's a requirement, which is an hour. And then we have something where you can have direct supervision with your treatment team. Okay, because there's always treatment team meetings to consult and talk about your caseload with the clients. And that's where you meet with your entire team who's on the team. You meet weekly, sometimes 2 to 3 times a week, just depend. Each program is different. And in those meetings, you talk about caseloads of your client, you talk about treatment goals and objectives, and you talk about ways that you can continue to support the client that's in discussion at that time, whether it's your client or whether it's someone on your team that needs some advice or support on how to work with a client. The other thing that we offer here is we have intern supervision that Phillip and I have created as part of the training programs, the directives that we have. So that's all embedded. So there's 3 areas where our students get supervision. There's supervision all around, either one-on-one with their LCSW in the team meeting, and also through intern supervision, which is the group intern supervision, where all the interns come together, where they have their didactic training, and then we have group supervision.
Yeah, the only thing I just want to add yeah, we have weekly individual supervision with the supervisor, 2 hours of group supervision, and then the group supervision, the weekly group supervision consists of 1 hour of didactics or seminar, and then the other hour is processing. So when students start in September, the entire month is devoted to orientation and training. So we want our students to be fully trained before they start seeing their clients. So they get a whole month just purely for orientation, getting to know their teams, getting to know their supervisor, and then of course other onboarding issues like getting an ID, getting training in our data system like Avatar, getting safety training, getting to know the interns. We do some icebreakers, get to know each other. We tell our stories. So we want to make sure that the students feel welcomed, that they're adequately, trained. And then for the rest of the year, they'll have their weekly individual supervision as well as their weekly group supervision. Now, in the group supervision, as Michelle and I mentioned earlier, one component is clinical training or didactics, so they'll be trained in various clinical topics. And I'm going to read you some of the trainings that have occurred in the past year, 2 years, in the past years. So one is motivational interviewing, because a lot of our clients have substance abuse issues. They'll be trained in CBT for psychosis. Another one, which is what I do, is acceptance and commitment therapy. So I do ACT trainings, and I use the ACT matrix. It's a clinical tool that I use for all kinds of things, group processing, as well as using it for our clients. And then another topic might be working with dually diagnosed individuals. Another might be, like learning about the various types of conservatorships, because we'll be working with conservators throughout the system, getting to know the justice system. So, we have quite a few people from our forensics department who come in and talk about how to work with justice involved clients. Of course, working with LGBT clients as well. We also have working with culturally diverse individuals. We have all of these things are embedded within the frame of fighting anti-Black racism and social justice. We know that last year, some of these issues have come to the fore, but we've been doing social justice work for many years. We have about 7 different committees that are devoted to fighting anti-Black racism, as well as promoting social justice within a clinical setting.
I just want to add one more thing to that, Dakota, which I think is a very important piece here, along with Phillip's statement. So part of the didactics is, once we complete all the trainings, there's a period, I think it starts, and Phillip, you could correct me, it's either in February, March, April, where the students, the interns, are expected to give a case presentation on the client that they have been working with. So that is information that is our presentation that they do amongst all of their peers, the other students from the other school, during that 2-hour supervision towards the end of their internship. And they build and work with that client throughout the whole process, the whole entire term that they're here, and they present to us. And then we have a Q&A, which gives the student and their peers to answer, and also offer information and support around how best to continue to support that particular client. That, I think, is a key piece too, because it also shows their growth. And when they first started with because it's amazing when they first come here, a lot of them are nervous and have jitters, but by the time the internship ends, they're able to process and share the information. And then you see this learning curve just kind of accelerates, and the language and the verbiage, and then you can see that they're more comfortable working in this setting. But the case presentation is a key piece here with our students. Everyone here at Citywide, even though we have several different programs, the foundation of the work is the same. And what I mean by that, the training of how to do case management here is the same. And I can say, once you get that key foundation, you can really take that skill set and transfer to any team or program. The only difference is the focus of the team or the program. And I think you have to come with, me personally, you have to come here with a sense of passion, a sense of open-mindedness. You also have to realize that you have to come down to the client's level, and all of that comes from yourself in a contribution towards the work. So I feel like once you build the rapport, once you kind of open your eyes to a sense of humanity, because you have to have that working with this population, and a sense of passion, you can be able to take in everybody's, I should say, advice, teachings. You have to be a good listener, and you could take all that, and then you could contribute all of that to your frame of work when you're dealing with the clients. And that's what I would say, for at least personally from me. Phil?
Thank you. Yeah, so I would say that to be successful as a clinical case manager at Citywide, number one, you want to be committed to this population. a population that is marginalized, that is coping with severe mental illness, but who are also very creative and resilient. But we have to be able to have empathy for these individuals. This is not a typical like sit in the couch, and then do psychoanalysis kind of a setting. However, the second characteristic is you want to be passionate about bringing clinical theory into praxis. You need both, and we believe in taking therapy to where the clients are at. That's the difference between a typical traditional therapy setting versus where we're at, because we're not just office based. So we have to be willing to roll up our sleeves and then go out as well as doing telehealth. Some clients may not be able to have access to other computer equipment, in which case we may have to do some outreach. So if you're willing to do some outreach, make sure you wear a mask and do all the social distancing, but still do outreach, then this job is for you. But the great thing is that you get to apply clinical theory within the client's own setting. So it's kind of like psychology meets anthropology, you know, because you get to do this in their social milieu. And then finally, the most I think this is most important is we want to be committed to social justice. So yes, this is we're dealing with a lot of clinical issues, but we believe that a lot of mental health issues are embedded within a broader systemic framework. And if we don't address the broader systemic issues, then that's actually producing the trauma for some individuals. Then how are we truly going to be healing agents? So we want the best of clinical work with a willingness to go out to the streets if we need to, combined with the broader social work outlook.
The thing that I can say that's most challenging here at Citywide is, I would have to say, the variables that come with the current times. One of the things I could say, because I've been here almost 20 years, and I've seen services cut. I've seen the increase of homelessness. I've seen the increase of substance abuse use. I've seen clients have more adversities, although we're here to help and support them. There's things outside our agency that is making our jobs that more challenging. So that, I would say, is a challenge within itself. We're still here to do the work. Like Phillip just said, you have to really come here with a sense of compassion, knowing that a lot of the people that we see outside of Citywide, to mainstream people, they're invisible, but when they come here, they're seen. So we try to promote a safe place for them to come, a safe place where they can come and be themselves, receive services. And even if they don't have an appointment, they can still come in, eat lunch, and do some socialization and participate in an art group. They don't get that outside of our doors. When they leave outside, they have to go into survival mode, and then they have to be subjective to how people see them. So I would say the challenges that we have is what they do outside, and then them coming here, we have to continue to provide those services and make them feel safe. And then all the other things that come along with being a case manager is like, there's just not enough resources, So you have to be creative, supportive, you have to advocate. And some of those things can be challenging because you want to be heard. You want to be heard. You want to make sure that the client get their needs met. And sometimes you run into obstacles and saying, why is it so difficult when this client absolutely needs these things done? So I can say that part of the job is challenging. Phillip, you want to add to that?
Yeah, I guess this could be the most rewarding job you'll find or internship you'll find, unless you disagree with some key things, like, are you willing to go out and be where the clients are at? Are you willing to go out into the streets, or are you only wanting to do psychotherapy via telehealth? I think if that's the only thing you want to do, then you'll find it very challenging to be here, because a lot of our clients don't have the luxury of using telehealth. So if you know a little bit about community mental health and you want to work with folks who are really marginalized and who are severely mentally ill, I think you'll have a great time. It'll be very rewarding. It'll be challenging, but it'll be worth it. But if you just want to do psychotherapy, then this may not be the right placement for you.
I would just say that if you came to Citywide Case Management, I can almost guarantee that you will have a rewarding internship experience. You will have lots of support. I think it's a great place for people who are interested in community mental health to get the foundation and get the training and the skill set. I think no question is a dumb question. I think this is the place where you can make mistakes and learn from them. Yeah, like I said before, I started out as an intern here and I've been here ever since. And I'm gonna let, if Phil wants to speak on his experience about that, I think he can. But I'm just gonna say, come on down, give us a try. And if it works, you're welcome.
Yeah, one thing I want to say, you know, there's a lot of CIS students that want to do their internship in January. Unfortunately, we can only start in September, but we'll be willing to extend our internship for you if you need to do the whole year. So it'll be from September to September. But once you're okay with that, and once you are okay with working with the most marginalized folks, who many of whom are substance using and out in the streets, but they're just amazing folks. If you want to do that, and if you're interested in that, this may be the place for you. As Michelle said, I've also been here for 20 years, and I was also an intern here at Citywide, and I'm still here. It's still a rewarding job. The thing that I like about Citywide is it's an open field. You know, we're going to do anything and everything we can to support our folks, because the traditional model of mental health does not work. We work in a broken system, so a lot of us are without adequate resources. That's why we have to be creative. We've made some movies here, believe it or not. We've done all kinds of crazy and unthinkable interventions to help our clients, and it keeps us on our toes. One of the things that I really appreciate about our internship is I get to bring in my interest and passion in clinical, like clinical psychology, like acceptance and commitment therapy. We have a DBT program here. And I get to bring that with social justice, because I'm also equally passionate about social justice issues. Michelle is Black, I'm Asian. We have a lot of stories between us as well. We want to share, you know, our passion for social justice with our interns as well. No matter what color or nationality you're from, you're going to be welcome here as long as you're willing to learn about how social justice can come together with community work and mental health practice. That's all I have to say.